There we go. And we're live. And we're live. It's been a while since I've done this one where I stream on both ends. Let me move this chair out. It's kind of silly. Hello. Oh, still open. Whatever, man. Miss Pierre, how are you? Welcome. Welcome to this live edition. So today we are simulcasting on Instagram and YouTube directly. I do a live video every week, 99% of the time on Wednesdays, and it's to follow up the video of the week. This week's video was related to home health care, particularly preparing for your Medicare survey if you're going to be a home healthcare agency. Now, many people who are following me on Instagram or even on YouTube have come to know about me through my interview with Earn Your Leisure. If you guys aren't familiar with Earn Your Leisure is a business podcast, probably one of the best in the world, technically, because they are trending and growing throughout the nation, really discussing entrepreneurship, business investing, etc. So fortunately for me, I was featured on that podcast a few months back, and I talked about home healthcare and healthcare staffing. And because of that, people follow me for that reason and are looking to learn about those businesses. I've grown multi-million-dollar home healthcare and healthcare staffing businesses, currently expanding that operation here in Florida and executing a consolidation of home healthcare companies, really to grow out a 9-figure home healthcare agency for the purpose of either going public or packaging it and reselling it. So I'm actually covering that on the channel as well. It's moves a lot slower than starting a home healthcare agency, and it's definitely not for everybody. It's not going to be everybody's cup of tea, but I will touch in and talk about that and maybe do other podcasts and give updates as to how you build a really empire level company. And that's what we're doing here. So everybody on Instagram, I'm actually going to be keeping this live going the entire time. I will see your questions. I know the Instagram attention span is far shorter than the YouTube attention span. So for people who are on Instagram and do want to come back, this live will be here for whatever amount of time it stays. But this video is also being casted on YouTube, where it will be archived for as long as YouTube is a platform. Okay, perfect. So today's video, we're going to be talking about home healthcare and the healthcare staffing businesses. And I'm also going to kind of start out by saying, this spring, I'm launching a how to start not a home healthcare agency, but how to start a healthcare staffing firm for anybody who's a nurse, physical therapist, occupational therapist, respiratory therapist, or even non-healthcare professionals could even register for this program and really learn how to build a workforce that you're making a spread over, placing them in long-term care facilities, hospitals, or wherever else they're being employed. These could be engineers, tech folks, security guards, whatever it is, teaching you guys how you can start these businesses where you're building a pool of employees and making some sort of revenue spread above what you're paying them. And this is what I'll be teaching. So for those of you who are interested in that, just shoot me an email. How does this thing work? Just shoot me an email. I don't know why. Pop-up chat. What's going on here? Close that. Weird stuff. Yeah, not sure how this works, but I'm trying to chat here, but I don't know. It's not filling the space. I'm like a bonehead when it comes to this. I usually stream on StreamYard, but I'm doing it this time directly on YouTube. Okay. Kaiser, what's going on? Angelina's in the house. Wow. These are my close friends and family checking in. Wife. India Page. What's up? What's up? What's up? Lucky Mofo. What's up? Cecilia, how are you? Welcome. Yeah, so this spring I'm going to be launching this course, and it's actually going to be I think it's going to be even more useful than my Killing the American Dream course, where I teach how to invest in 1 to 4 family real estate. And the reason why I think it's going to be more useful is because there's not much information on the internet about how to start these healthcare businesses. Tons of people flipping real estate, tons of people teaching you how to do that. I actually think the market's kind of overcooked right now anyway. But this would be a good opportunity for you to learn. Not only am I teaching you how to start these businesses, but I do have a mentoring option and like a full turnkey package that's just shy of a franchise. I'm not interested in being a franchise owner, but providing the same level of, I guess, startup assistance that a franchise would offer. So I'm just going to share my email address here so that if you're interested in getting in line for that program, you can. So that's going to be right there on YouTube, carl@soulslepier.com. Just use subject line staffing agency so I can filter you and know exactly what you're reaching out to me about. I do get a lot of emails about a bunch of different things, whether it's investing in Italy for the 1 year homes or inquiries about aviation. So please make your subject line staffing agency, staffing firm, healthcare staffing, home health, something along those lines where I know that it's related to healthcare. Perry, I don't know how much I'm charging yet. I think when I see the final product, there's going to be a few different levels to it. One is going to be just kind of pay for the course and watch the videos and kind of self-directed. Then there'll probably be a mid-tier mentoring option, and then there'll probably be a high-level mentoring option where it's more turnkey, more hand-holding than anything, maybe more tools, etc. So I'm not sure. Um, I would say it would be safe to say anywhere between this is going to sound ridiculous, but anywhere between about $100 if it's like a monthly recurring fee to $10,000 if it's a one-time kind of full turnkey setup. That's what I'm thinking. But once I know what the final course length is going to be and um, when I really see what my final product is, then I'll be able to price it appropriately. But I think, like my Killing the American Dream program, I price it fairly for people who have different, um, I guess, capacities financially. And it's really up to you to fill in where you're missing. If you're missing on the cash and you have to put in more elbow grease, then that's how it goes in life. If you have more cash and you want to expedite the process, then there's a fee for that. But I haven't solidified that. Anyway, this week I talked about preparing for Medicare survey. As a home healthcare agency that's going to be billing Medicare, meaning you're billing the federal entitlement program, you need to have an accreditation body in place. At least in most states. I hear weird things in some states, but in most states, you need to have an accreditation body in place that is supervising your operation. And they do a supervisory visit every 2 to 3 years on average to check in and make sure that you're following rules and regulations, that you've updated your policies accordingly, that you're providing the right type of patient care, you're not a fraudulent agency, things like that. When you're just getting licensed and you're just getting into a new territory, you're going to have to go through one of these surveys. Okay. So in this week's video, I talked about how to prepare for that survey and what to expect going into the survey. This is, making sure your policy and procedures are in place, that you've hired a few employees, that you've serviced a few patients so that they could actually review real patient files. They actually go on real visits to patients' homes. They review how your employees are working in these patients' homes, and they also review those employee files. And then, of course, they interview and review the operations internally in your administrative offices. So we've already completed that and passed that and received our Medicare number. We're at one last step, which is to verify that we have $100,000 or 98,000 and some change, but $100,000 in cash reserves, because the expectation is that you need enough operating capital to float your payroll, to float your nursing services, while Medicare gets their act together to reimburse you for services. Um, and that's why when people tell me, hey, I want to start a home healthcare agency, I usually tell them to start a healthcare staffing firm. And I tell them to start a healthcare staffing firm because it's less hoops and circles to jump through. The average home healthcare agency in the United States does less than $2 million of revenue a year. Okay. If you're even doing a 20% margin on 2 million, then you're netting $400,000. Good money. I mean, and that's 400,000 after all expenses and salaries and that sort of thing. You're netting good money, but I wouldn't say that's what's going to make you wealthy. All right. You might be able to turn around and sell that company for about $2 million, right? You're going to be able to get a 5-time multiple on that, but it's not, going to make you, the average home healthcare operator isn't going to be clearing $1 million of profits a year. Just because they don't really break that threshold. The average doesn't get above that. Then there's a few that do. They get to mid-size, and they usually get gobbled up by the big guys. And then you have, the companies that are doing 300, 400, $1 billion in sales per year. So, and at that point, if you're making a 20%, 30% margin, you're talking about, $1 billion. You're clearing $200 million a year. Things get interesting at that point, right? So I I because those numbers are sexy to people are drawn to home health. But healthcare staffing really offers you the same access to the healthcare industry with less regulation and less, just like I said, hoops and circles to jump through, right? So when people say, "Hey, I'm trying to get into home health," I always redirect them to healthcare staffing, not because I'm like trying to keep the home healthcare market to myself. Even the largest player has less than 2% of the federal or the national market share. So there's plenty of room for competition. So I'm not concerned with that. The real issue is that most people don't have the desire and the know-how and the innate ability to be successful in the home healthcare space. And it is a heavier start and a more more cash intensive start. And because of that, I say, why? When you could get this low hanging fruit in healthcare staffing, especially if you were in healthcare staffing right now during this entire pandemic. Hospitals were short on nurses that wanted to work ICU, that wanted to work emergency, that wanted to work in hospitals, period. And if you were in that space, you could have truly benefited from all the travel assignments that came to be and made a nice amount of money in these times. And most healthcare facilities are understaffed always. So there's usually the potential to have reoccurring business in that arena. So that's why I tend to promote that. Now, does anybody have any questions? Instagram, the short attention span is amazing. Anybody have any questions? Because this is what these live sessions are about. It's not really meant for me to sit here and lecture, but really to allow the community that we've built here at ENTP Life ask questions, get feedback, get some advice. This is the closest that we get to like one-on-one consultation. So really take advantage of the information that I have and what I'm willing to share. So that's what this is for. And for those of you who are here, I see that there's 13 people checked in. Please like, share, do all the things that YouTube likes, which will help promote my video a little further in the YouTube ether, I guess. So those of you who are here and you feel this is valuable information, please just do that for me. Savvy Business Chick, hello. Just learned about your page recently. What's your name on Instagram? Okay, Savvy, I am at ENTP underscore life. On Instagram. So if you need to message me, I guess if that's what your interest is, you could do so. I really don't, no offense, guys, but I really don't like Instagram. Um, I only use that platform to push out my information. I don't use that platform to discover anything. I don't know how it works. I don't like it, but people are on it and use it. And what I notice about Instagram is everybody wants to send you like personalized message asking for advice or something like that. And I feel like more people are comfortable doing that because there's like a private conversation happening rather than just using the comment section on YouTube. But I'm not trying to give one-on-one consultations through Instagram. Not saying that's your intention, but it's kind of weird. It's like if I'm here, what I'm more active and I care more about the YouTube community. Again, sorry guys, but that's my platform of choice when I'm looking for information. And because I'm an information junkie, I'm on YouTube all the time. I don't mind commenting. I don't mind sharing information in comments. I don't even mind bringing people who have questions from YouTube onto the channel to discuss, their particular problem or their particular need. So yes, I guess, you could ask your questions right here, Savvy Business Chick. I do this so everybody could benefit. So your questions may actually be something else that somebody may have. So it's always good to just use the public forum and ask them. Bop, 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 bop. Melissa Toussaint, I know we've been in touch recently. Hello. Emailed you today. Look forward to flying sometime. Amory. Yes. Like I said, I'm pretty busy, kind of insanely. If you guys haven't noticed, my schedule has been completely off. I don't post that much on Instagram. I haven't been working out. I'm in the middle of moving, so I'm traveling between New York and Florida constantly because I'm working on deals between the two states. So, if I am slow to respond, it's because life is happening for me. I try to respond as quickly as possible. And for flying, like I was just in Sarasota for the past 3 days for a conference. And I would have much rather flown from Fort Lauderdale to Sarasota, but the weather was crappy and I'm not instrument rated. So I ended up driving. So 3.5 hours each way, 7 hours of lost time. Meanwhile, on my plane, it would have taken me an hour and 20 minutes or hour and 15, something like that. So I do want to fly more often. So knowing that you're interested helps because then I could kind of put the messages out when I want, some assistance, especially from other pilots or people who are learning. It helps to have an extra set of eyes out there. How to get private paying clients as a startup home care agency. Okay, so Mitkumar Patel is asking a question: how to get private paying clients as a startup home care agency. You're going to have to advertise, or you're going to have to buy leads. And by advertise, you're going to want to, when you're looking at private pay clients, the most important thing is the ability to pay, right? You could say average rate is going to be between $20 and $30 per hour for home health care. So for someone who requires 40 hours of service per week, that's going to be $800 to $1,200 a week. All right. For your average American, that's more than what they might make at their job, right? Talk about a disabled person, chronically ill person, senior citizen, even less. So when you're looking at trying to secure private pay clients, you have to get into a upper middle class to high net worth market because they're the ones that are going to be able to afford the home health care out of pocket, or they're the ones who had invested in long-term care insurance in their earlier or younger years. And the people who have long-term care insurance, private long-term care insurance, we're not talking about Medicaid managed long-term care or or any of the government sponsored programs, but truly a private pay client, those who have long-term care insurance were also upper middle class, the high net worth people who had the disposable income that when the financial advisor came to sell them on some products, the annuities, the life insurance fund, life insurance, they also offered up things like long-term care insurance because that was just a tiny portion of the total premium. They might have been contributing $5, $10,000, $20,000 a month, and $500 of that was allocated to long-term care insurance. And long-term care in your later years is expensive. So, you're going to want to zero in on high net worth neighborhoods. And you're going to want to either send mailers, either get into the publications that are in that area, or run localized ads on Facebook and Instagram and Google for your services in those particular high net worth zip codes. So every neighborhood has the wealthy part of town. You're going to have to concentrate there. Okay. And you're going to have to become visible in their eyes, and you're going to have to also build relationships. And what's cool about the high net worth community is they are pretty tied in as far as a community is concerned, right? They might live in gated towns. They may play golf or have the same access to the same country clubs, may play bridge together. So they're together and talking and sharing ideas, especially financial ideas. They talk about these things. So a lot of the private pay audience ends up getting word of mouth referrals. So you need to pay at first for the visibility, provide a top-notch service, and consistently remind your clients that you are the agency of choice. And if there's anybody that they know who may need services, feel free to refer. You give a referral discount, things like that, whatever. Get your clients talking to their friends, talking to their family, referring you when somebody's like, you know what? My husband, he's getting forgetful, et cetera, et cetera, et cetera. I think I might need help. Who are you using? I know that you have a need for your husband, or I know you have somebody. What are the rates like, and how, and they talk amongst themselves. So you're going to want to tap into that. But the first thing is you need to become visible and known in those particular markets, then provide a good service, then have those same clients helping to promote your services amongst their network. So I hope Mit Kumar, I answered your question. Okay, Robert Campbell. If you start off with a staffing agency, at what point do you transition to medical care? Why would you want to do that? I wouldn't say staffing is the stepping stone to home health, because you could have a robust staffing business where you never have the responsibility of caring for. Listen, in home health care, you're responsible for caring for people. You will get audited by Medicare. You will get audited by the governing bodies. You may have to pay back money if they find any sort of mistake. Home health care is not sexy. I keep telling people that. This is a hard business. It is not a sexy business. It is not an easy business. So get that out of your mind. If you're looking for something that's easier, staffing is easier and just as lucrative and as scalable. For example, you could be providing staffing services in multiple states, and none of those states require any sort of licensing. No supervision. Just, hey, I have some nurses in Florida. Florida doesn't pay that well. New York does. They've expressed interest in travel assignments. Let me start calling around to different hospitals in high paying states. You're not restricted. Right now in Florida, my home health care agency is restricted to the geography of Broward County. And if I want to get additional counties, I have to apply for this to the state, set up a new office in that county, hire new staff, blah, 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 blah. Right? Meanwhile, if I want to provide nurses to uh, Palm Beach, Miami, New York, New Jersey, insert whatever city you want, I could do that without any kind of restriction. So why, why the desire to jump into medical care? If you're passionate about home health and you see that there's a real need for servicing clients in the home as a method of improved outcomes, as a method of hospital readmission reduction, as a means of really getting face to face and personal and really being a community asset to people in need, if that's where your heart is, then go into home health. If you're looking to make money, probably don't go into home health. If it's just money, if your decision to be a healthcare entrepreneur is purely driven by there's a lot of dollars in healthcare, I want in. If that's your angle, do not provide medical care services. Just don't do that. Just provide business to business services like staffing, like software, like billing services, like etc. Do not get involved in the patient care, because once you start putting your hands on patients, liability goes up, everything goes up, everything goes up. So, and not necessarily your revenue. All right. And that's my piece on that. Savvy business check. This is great because the other videos of yours I found it wouldn't let me leave a comment. Really? That's very strange, Savvy business check, because everybody's welcome to leave comments on my videos. You're not blocked or anything. When can the transition of turning a staffing agency into a home health care agency? No. I already talked about that. Get that out your mind. You could do both, but really, if you want to do home health, because that's where your heart is, then do home health. Okay. If you want to get into healthcare staffing, get into healthcare staffing. Both can make equal amounts of money. Just two different risk profiles in each space. I get it. I don't fly as much as I want to either, AO. I emailed you about the staffing agency, though. Definitely interested in that. Yep, I'll be in contact. Thanks for reaching out. Do you have any pediatric clients in your business or plans to include peds? Very rarely do we take ped clients, mainly because once again, higher risk profile. The caregivers are more anxious, and it's just not the line of business that I want to get in. I personally don't like seeing sick children. It just breaks my heart. So if you want to get into peds and that's your passion, that's your love, then you should go into peds. If that's what your training is in, go into peds. If it's something else, then try something else. Onyeka Miller. Onyeka. So what are you emailing me about now that we're here talking? I most likely have seen it. I most likely have filed it. But what are you particularly emailing about? If you're emailing for more information about the staffing firms, I haven't started to send out more information yet. If you have a particular question, then I would highly suggest, now that you have my attention, you ask. See if I got any other questions here. Instagram. Instagram. iHeartware. Okay, when will your thing become available? I would like to get more information about contract staffing. Okay, if you're still around, definitely reach out. The best thing you could do is shoot me an email. What's up? What's up? Started out wholesaling in New York. So excited that that's how I found your video. What's up, guys? Instagram is so weird, man. Okay. You've emailed me about home care business. And what about that? If you're driving, I can understand why you don't want to text, but if you're not driving, be a little more specific with what you're trying to. What are you trying to get out of that email? How to get started? The entire how to get started. I've been covering exactly how to get started on the channel. I have an entire playlist from episode 1 of how to start a home care agency. And if you want to work with a consultant, which I do not consult to get started, I work with a consultant. They're the same consultants that got me set up. I can introduce you so that, you're talking directly to one of the owners of the company. I was with him today so that you can, get services to get started. Yeah, I don't do one-on-one consultations, unfortunately. So if you're a nurse, let me see what I'm gonna do now. Let me look up your name. And I'm gonna actually set this up now so that we don't miss it again. Come on, come on, come on. So what happens when you have like 17 Gmails? So what I'm going to do is I'm going to link you. I'm going to start writing the email now. I don't know what happened, but let's see. I don't see your emails. Let me see. I'm going to search by email address. In the meantime, as I do this, you guys might as well, or ladies and gentlemen, might as well start loading up your questions. Because once those questions run out, I will. I see your name. What's going on here? Staffing agency. Strange. Yeah, I have you loaded up here, but I cannot find your email. Whatever. But I'm gonna link you. I'm starting the email now. I'll finish it at the end of the live, and I'll connect you with the principal there, and he could at least help you get started. If you're looking to do one-on-one services, well, to be honest with you, the process is, if you're looking to build one-on-one, like you're just looking to do direct services, I really don't know what that process is too much. But if you're looking to start an agency that's going to build Medicare, Medicaid, I don't know what state you're in. If you're in New York, forget it. New York is not issuing any new licenses. So, you're going to have to pay upwards of $200,000 to get one. So yeah, if you're upstate, I think I might have responded that to you. That is going to require you to spend. You're going to have to buy an agency. I know of an agency right now that's for sale for about $750,000 in upstate. I could introduce you to that broker if you want to buy it. Let me see what else. Savvy chick. Okay, thanks. I just followed you on Instagram and I have a pediatric home care agency in Maryland. Was looking to do it as a staffing agency. Are you accepting interview requests? Sure, I suppose. I have been in the medical sales side for 15 years and just wondering if it's necessary to be a healthcare professional to start the staffing agency. No, it's not necessary. I have over 60,000 emails for the dental field. So you want to start staffing in dentistry? You already have the leads to potentially get clients. Then it's going to be a matter to get staff. I think if that's the case, you might as well try. You don't need I would say the majority of states don't require a license for staffing or any kind of business license or anything like that. If they do, the barriers to entry are very low. It's usually like paying a bond and having insurance and going to consumer affairs or the county clerk or whatever the case may be and paying your fee. But for the most part, they're not even regulated. I also have access to nursing contacts. Yeah, so I think you got a good start. I'm a retired nurse. I will return, but don't know my options. I'm in Atlanta. You're a retired nurse. I would return, but don't know my options. Well, you could consult. You can start an agency, home health care, or staffing. I would say those are pretty much your options. You could get into, you know, equipment sales. You could get into memory work. You get into a lot. You could just do per diem yourself. Somebody's name who's just random letters. Uh, Hello, I just started to watch. What things do you wish you had done when you were 21? I'm a newly graduated college student, majored in health administration, and would love to get some insight. Jay. Okay, we'll call you Jay for now. So, Jay, when I was 21, I was already in business. Uh, so I kind of learned kind of organically through the family business, then independently. So I already had 5 years of experience, more than 5 years, 7 years of experience in healthcare staffing by that time, because I started working in the family business at 14. So looking back at 21-year-old me and looking at what I'm doing now, I would have interned at a private equity firm, considering that is what I'm doing now. Not interning, but um, putting together a platform company for the intentions of consolidating and forcing value. Um, so I wish I had done that. I kind of wish that directly after I had gone to get my master's in business administration, just because I would have been exposed to certain concepts earlier and I would have met different people. I would have met people who were working in private equity firms or looking to get into private equity, and just the conversations that I would have had and the case studies that I would have learned in my master's in business administration course would have allowed me to get to the point that I am now, probably when I was like 28, 27. So it would have sped up my process by just putting myself in an environment with older, more experienced, savvier healthcare entrepreneurs. Um, so for someone who's 21 and who's entrepreneurial in spirit, who's looking to potentially, if you're looking to own hospitals, facilities, do bigger and bigger deals and really extract value, I would say get your MBA and network to find your way into being groomed in some private equity firm that focuses on healthcare, learn the hustle there, and skip all this startup stuff and kind of go into this business that way, because this startup stuff is rough. Most of the people who are starting up are um, healthcare professionals, undercapitalized, no business savvy, no business acumen. They've only worked in the hospitals. Maybe they've been managers, but they don't really have the tools that they need to really succeed in this business. For me, I'm 38 years old and I've been doing this since I was 14. So my I have the experience of like a 55-year-old man who has been in this business, professionally, right? Went to college, then started working, and then started working in management. I would have the equivalent of a 55-year-old man, but I'm 38 years old. So, whatever you can do to speed up that process is what I would advise. Because if you look at most of the high net worth people in the world, they're older. They got their grays and their bald spot, and they have 15, 20 years plus in of specialization in a particular field, and that's what makes them valuable. One more question from the savvy business chick. Are you familiar with senior placement services or nurse referral services as an agency? I know that they exist, and their business is to generate leads, and they monetize those leads for people who are looking to be placed. One successful one is caring.com. All they've done is corner the internet and have tons and tons and tons of leads for placement, and they turn around and sell access to those leads, whether it's access to the leads themselves or access to the actual client for like the exclusive placement. But they exist. Our agency, Sonia Johnson, our agency's in Missouri. It's having a difficult time finding full-time staff. Would love your advice. So, are you a staffing agency or a home health care agency, Sonia? Mr. Rosales in the house. How are you? Sonia, your question is going to be my last question for this session. I need to get home. Like I said, this morning I started out in Sarasota, 3.5 hours driving across this freaking state. I need to get into my bed. Home health. You're having a difficult time finding full-time staff in home health. Are you talking about aides or are you talking about nurses? What sort of staff are you having a hard time hiring? The more detailed and specific your question is, the better and better answer you're going to get. You have to use your words to explain what's going on. I don't know what the limitations are. Okay, aid CNA. Listen, the government is giving out more money than aides and CNAs make in unemployment. So there you go. This is a nationwide problem. In New York, I think it got up to like $900 a month in unemployment benefits. Average aide's making $15 an hour. So why would you ever get up and go to work if you're making more money sitting on your butt? Why would you get up and go to work when you're making more money and you have the extra burden of trying to homeschool your kids because schools are closing left and right or just not open? Not until the government stops paying people to not work, then we're going to be dealing with this problem. And that's the main issue. Typically, you're going to find aides because most aides are working one or two, definitely working one job, most likely working two, just so they can make it. But in these times, aides are getting paid to not work. And then they have the, added fear of COVID and added risk there. So, you have to expect that this is what's going to happen. What you may have to do is just up your maybe up your pay, make it a little more attractive. You may have to sponsor training, for people who are looking to get into that career path. You may have to increase your spend on ads for those employees. Ultimately, but like I said, what you're dealing with, you're in competition with. Here's the same pay or more for not working. Hello, welcome. So anyway, Sonia, thank you very much for asking the very last question. Anybody else who has a question could use the comment section for this video. I do answer or try to answer every single comment. If it's a new comment, my new comment box is empty. I check it every day, maybe every other day. I clear my comments by giving an answer. So if you're late to this video, that's it. Once again, if you are interested in learning how to start a healthcare staffing firm, not a home healthcare agency, a healthcare staffing firm, email me, carl@soloslopierre.com. Like, subscribe, and I'll see you in the next one. Take care, folks. And oh yeah, Onyeka, I'm going to email you and connect you with the consultant right now.